Hello, this is Dr. Malescu, week 3. Can you believe it? We are almost done. We have 2 more weeks and we are done with this course. So we are moving on into our 3rd week journey, practical applications and infection prevention. So this is chapter 5. Make sure you read the chapter. It's not enough that you listen to my video here and take notes. You need to actually read the chapter and take notes and do all the work that needs to be done for this week 3. All right, so let's talk about protecting our patients and ourselves from infection. Let's begin by discussing how do we prevent infection? Hand washing, right? This was a big subject during this pandemic last 2.5 years. Hand washing, making sure everyone knows the standard precautions and protocols that are set in a hospital setting or in a clinical private office setting. The transmission-based precautions are universal and are implemented via what we call OSHA regulations. Now, the portals of entry. So what does that mean? How do these pathogens enter anywhere where there's an opening, right? So our nose, our mouth, our anus, okay? Vagina if you're a female. So the respiratory tract is a vulnerable point since we can inhale organisms in and they can enter into the entire respiratory system. The gastrointestinal tract, when we're eating our food, some food may be contaminated, maybe the drink, the water may be contaminated. Genitourinary tract, there are parasites in a lake that if you go in a lake and you decide to urinate, guess what? The parasite follows the stream of urine and gets inside of you via the genitourinary tract. Oh, the urethra. Terrible, right? What else? Non-intact skin. So if you have an open wound, a cut, any of those are game for bacteria or other pathogens, viruses, as well as parasites to get in. So a pathogen is anything that is potentially going to cause disease, and a pathogen will be halted by our immune system, and it can stay local, but if it is poorly controlled, it can lead to a systemic infection. Now, let's discuss a little bit on the reservoirs of infection. What does that mean? We have people that are carriers. So we have asymptomatic carriers. We have people that have had COVID and then they get COVID again, but their immune system's so strong. They don't have any symptoms, but they are carriers, okay? They are carrying this virus. Animals can be carriers. The environment can be a fomite. A fomite is any non-living object that is like a table that has germs. Any kind of pathogen on a table can be transmitted to the individual. Hospital procedures. This is nosocomial infections. We talked about this last week. Routes of transmission. How does it get transmitted? Is it direct? Direct inoculation, me sneezing on you? Or is it indirect, me touching a table that had somebody's dirty hands on it, had a particular bacteria, and now I'm getting it, right? Because I rubbed it on my hands, rubbed my nose, and bam, I just inoculated myself. Is it airborne? Does it float in the air? Is it inhaled by another person? Is there a vector? These are organisms that act as reservoirs of infection. For example, the deer carries the tick carries the bacteria, and the bacteria provides you the source of infection, which is Borrelia burgdorferi, which causes Lyme disease. So the carrier, the vector, it can be a deer, and then that deer carries the tick, and the tick is another vector that is a reservoir of this particular bacteria that causes Lyme disease. That's just one example I'm giving you. So vector transmission is huge. It could be biological, which means that the pathogen located inside the vector's body is going to be transmitted. So a mosquito is the vector and carrier of malaria. The mechanical procedure of getting the infection is the actual pathogen located perhaps outside the vector's body. For example, instead of direct inoculation by the mosquito, biting you and then directly inoculating you with the pathogen that causes malaria. There's the mechanical way, not the biological way, the mechanical way where a fly just lands on you or lands on your food and drops its crap. So a fly will always poop on the food, just so you know, and a fly carries disease. And yes, it will. It'll land on the food and provide you direct inoculation mechanical for a particular disease. Terrible, but that's the way it works. Now, hand hygiene is huge. Without hand hygiene, the chances of getting an infection doubles, even triples. The simplest and most important method of avoiding any kind of infection is mechanically scrubbing and washing the hands, getting rid of the pathogens mechanically, as well as the soap itself having the enzymatic activity to kill the bacteria or the virus. So there's normal flora on our hands that are our skin bacteria that are, found normally, and they are the flora. They don't cause disease unless the bacteria multiply out of hand, right? So this is a normal resident on the skin is Staphylococcus aureus. To prevent contamination by other microorganisms competing for the food source, they usually are non-pathogenic unless it enters a sterile body cavity that's not supposed to have anything, and the person has an immune response that is, slowed down. They're immunocompromised, right? So you can have the normal flora that's not going to do anything for you. The normal flora actually will help you because it'll inhibit the bad bacteria from replicating, right? So these are found in the outer layer of your skin, the stratum corneum, and it will prevent contamination by antagonizing the other organisms that will cause disease, and they are competing for the same food source. So this way, your bacteria that's normally resident on your skin is going to be there, and it won't allow the other bacteria that may actually cause disease to be there and set up shop. Okay. The only reason why the flora would take over and cause an infection, as I said, is if it enters a location where you're not supposed to have that bacteria, and or right, having an immunocompromised patient. So what example would I give you? Staph aureus is a skin infection that if it gets out of hand, it can cause cellulitis. Staph aureus normally on the skin is not an issue unless it gets out of hand. All right, now what else? If that Staph aureus gets into the genitourinary tract, then you got a problem. Then you have a urinary tract infection. There's not supposed to be any bacteria in the urinary tract. So that's what I'm talking about. Now, let's move on and talk about transient flora. So transient flora is acquired during direct contact with patients. There is direct contamination of objects or surfaces with the patient. And, if you have proper hand hygiene, this wouldn't even be a problem. Okay. So it can be removed, these transient flora. So let's say you put your hand on a table at the hospital and it's filled with bacteria that was contaminated by some instrument, maybe even a stethoscope that was left by another nurse, which forgot to clean it from another patient. And that's how nosocomial infections continue to spread. All right. But if you wash your hands and you clean the stethoscope with alcohol, then perhaps you can stop it from, spreading. Also, a lot of people, besides the hand washing, when you are a nurse or a doctor, you cannot wear jewelry. So yeah, you can wear jewelry all you want when you're outdoors and, you are not working. Okay, but remove your jewelry before you wash your hands. Okay, you never want to touch anything. So you want to push the lever to release the paper towel. Do not tear it off yourself. Set the water as hot as tolerable because bacteria don't like heat. Wet your hands, scrub the hands very well with soap, and go in between the fingers. So the way it goes is outside the thumb, inside the thumb, outside the index finger, inside the index finger, outside and inside of the middle finger, outside index, middle finger and ring finger, until you do all sides of all fingers, palms and tops of the hands, and nails, scrub the nails. And you want to do this 25 to 30 seconds each side. So it takes about a good 15 minutes if you're doing it right. That's the basics of a hand scrub prior to the OR. Then you rinse the water, and you want the water to run downwards, okay, proximally. All right, you don't want to go this way, you want to go that way, so that your hands are as sterile as possible. You rinse the water with whatever possible mechanical removal of bacteria can occur this way, okay? Anyway, so these are some ways of hand washing. And then, of course, drying the hands, use a paper towel to turn off the water. And this is not like the sterile. This is, I'm talking about like when you go to, you know, a hospital setup, you know, a patient's room, not the OR particularly. In the OR, you're scrubbing for a long time, and you're doing sterile procedure where you, after you're finished scrubbing, you come in air dried, and you know, your instrument passer, your surge tech person, is going to help you glove up if you're the surgeon. So at least that's what I used to do. If there was no availability on that, there's a way to do it. There's a technique where you put your hand from the inside out and never touch the outside, obviously, which is going to touch the surgical site. Now you want to use alcohol-based antiseptic hand sanitizers in between patients when full hand washing is not possible, or if the hands are not visibly soiled. You still want to use antiseptic sanitizer. Use the same cleaning action for the hands, fingers, and nails, and continue using the sanitizer that has evaporated when the hands are dry. All right, now the fundamental principles of infection is that you want to have at least the minimal standards and consider that all patients are possibly contributing to an infection, which means that you can assume that everyone is causing an infection. Every single patient is a potential disease-causing source, okay? So the way that patients transmit disease is direct contact, droplets from speaking to them. Airborne precautions must be taken if you have suspicion of a particular respiratory disease, right? You use the standard precautions, and you make sure that you are aware of these precautions, and you make everyone else aware. This is how we get multi-resistant bacteria when some are left over that have become drug resistant and continue to proliferate nosocomial in the hospital, and that is a huge problem that we are coming across these days, all due to the overuse of antibiotics. And we're going to talk a little bit more about that in the next few lessons. Okay, so standard precautions when there's exposure to blood or body fluids, contaminated equipment, you want to use PPE, right? Personal protective equipment, PPE. Hand hygiene and proper use of PPE is huge. Cough etiquette, you never want to cough in your hand, okay? Elbow. Safe injection practice, never recap. A lot of people have been known to do this, and it's risky. Safe handling of potentially contaminated surface, and making sure the equipment as well is safely handled without any kind of possible exposure. Water and antimicrobial soap is the go-to, especially after eating, if the hands are visibly soiled, after using the bathroom, I don't need to tell you that, and if possible exposure to spore-forming organisms. These are all the reasons, all right? Alcohol-based rubs, including but not limited to alcohol-based rubs, before and after direct contact with a patient, and after removing gloves, and after contact with, even if the skin is intact, after skin contact with a patient, after contact with objects near a patient, you should still wash your hand. Basically, when in doubt, wash your hands. When in doubt, use the antimicrobial soap always. And if you don't have access to it right away, use the alcohol-based rubs no matter what. All right, so what are the PPE? The gloves, the gowns, and the face masks. The face masks usually have a shield to protect you from splattering of blood. Super important. Goggles that can be placed over the eyes during surgery, super important. Tissues and no-touch waste cans must be available. Cover the mouth when coughing and sneezing. When you cough and sneeze, again, the crook of the elbow if the tissue is not available. Perform hand hygiene after contact with respiratory secretions, whether it's yours or the patient's. Let's say you blow your nose, then you got to go wash your hands. Droplet precaution. This is super important. Again, avoid direct patient contact. If you have a respiratory illness, wear a mask. Okay, not just any mask. It must be a PPE mask that is protective. And again, hand hygiene, super important. Discard any used syringes and needles in the sharps box. Okay, making sure that you put it in the sharps box, and if the sharps box is too full, then you get another sharp box. So you don't want to cause yourself issues with that where you have some kind of accidental needle stick. Dispose of the single-use lancets properly and immediately after use. And when you're doing phlebotomy in dedicated areas, make sure that the proper supplies and hand washing stations are nearby after you draw blood. Label the blood tubes appropriately. Place the blood-contained tubes only on surfaces that can be properly cleaned afterwards. So let's say you're using a patient's table after you drew blood, then you put it in the sterile bag and you seal it up and you had labeled it and all that, great. Now you clean the surface of the table before you leave. Of course, the sharps go in the sharp box, right? So butterfly needle, whatever it is that you were using goes in the sharps box. Clean equipment, super important after surgery. You need to make sure not only do you clean the patient area, you need to make sure the instruments are clean, make sure the equipment is clean and disinfected, and the patient's room is disinfected and cleaned. All right, so the transmission types and precautions that we need to be aware of. The first precaution is you can get an infection via direct contact, airborne or droplet, all caused in conjunction with the standard precautions that we need to do, which is making sure that if there is an airborne infection, patient is isolated. So they need a private room, dedicated equipment to that patient. You need to disinfect the equipment when removed, and you need to make sure that the hand hygiene and proper use of PPE is implemented at all times, before and after. Airborne precautions. If you think it's going to be by droplet or dust, such as TB or measles, you need a negative pressure room with the door closed. You need proper PPE, which means not your regular mask, but a mask with a shield, and it must be fitted. Okay, that is a special fitted mask that every healthcare worker gets at the hospital. Okay, so moving on. The droplet precautions, illness will be spread through droplets, i.e. your good old flu, whooping cough. So again, they may need a private room. The door may remain open, okay, if they have a private room. But if it's TB, then it needs to be a negative pressure room. Door must be closed at all times. Surgical mask and other PPE is required, and hand hygiene before and after contact with the patient or contaminated objects, super important. Okay. Now, what about OSHA mandates? The OSHA stands for Occupational Safety and Health Administration Regulations, OSHA. Occupational Safety and health administration regulations. It mandates bloodborne pathogen standards with goals to prevent occupational related infections that we like to call nosocomial infections. And it's to prevent exposure to infectious organisms that is found in the blood or body fluids. Exposure control plan must be implemented and trained to every single employee of a clinical setting or hospital. There needs to be an annual update to abide by the OSHA regulations. There needs to be an implemented use of the standard precautions, and every single employee at the hospital must know of these standard precautions. There must be training every single year. OSHA is basically identifying and using engineering controls, ensuring the use of work practices that are there to solve any potential gaps in care where you're careless and potentially may spread nosocomial infection. OSHA requires providing PPE. So if they're in a hospital setting, all employees must have access to PPE. And that was the initial issue in New York City when the whole pandemic started occurring. They didn't have enough PPE for healthcare workers. All right, they need to have the availability of the hepatitis B vaccine to everyone. So every hospital and every clinical setting must have the availability of hepatitis B vaccine. And also, if there's any kind of accidental exposure, there must be a post-exposure protocol, evaluation, and follow-up. Also, making sure that there are labels and signs everywhere denoting hazards so that everyone knows what the hazards are, and making sure that every single worker at the hospital or in a clinical setting is aware of what needs to be done to maintain OSHA guidelines, maintaining the training records, and having proof that every single employee was trained on OSHA. So to summarize, we discussed direct contact, indirect contact. We discussed what indirect contact means, like, for example, the mosquito carrying a disease, the common vehicle, whether it's airborne, and the vectors, whether it's biological or mechanical. Mechanical was the example of the fly. All right, and then finally, the latter end of this lesson was all about proper hand washing, standard precautions such as hand hygiene, use of PPE, cough etiquette, elbow, respiratory hygiene, safe injection practice, safe handling, and of course, transmission-based precautions, contact, airborne, and droplet. Know the OSHA standards if you're going to work in a clinical setting. All right, and that's my lesson for today, week 3, chapter 5. See you next time. Bye.